The purpose of this speech is to persuade people to encourage others, mothers, fathers, and guardians to enroll their teens in a sex educational class to prevent further teen pregnancies. This will help them have proper information on what is happening. The main 3 points I will be discussing today are contraception, statistics on teen pregnancies, and the information the class will provide. At your age, you're supposed to be changing the world, not changing diapers. What is contraception? Contraception is the use of devices, drugs, agents, sexual practice, and surgical procedures to prevent conception or impregnation. In other words, birth control, which is also known as the practice of preventing unwanted pregnancies. Parents, we know the basic about birth, sex, and birth control, but do we know the facts? WomenHealth.gov informs us that there is no best form of birth control. Each method has its own cons and pros. According to Parenthood.org, it shows us that there are many safe and effective methods available today. This is important to find. It is important to find the method that is best for you and learning about each method so you can make the right decision. Here are some methods and typical uses. According to guttermatcher.org, in 2008, nearly 750,000 women younger than 20 became pregnant. 733,000 pregnancies were among teenagers ages 15 through 19, and 13,500 were ages 14 and younger. New Mexico had the highest rate at 93 pregnancies per 1,000 between ages 15 and 19. The states in the U.S. that ranked the highest were Mississippi, Texas, Nevada, Arkansas, and Arizona, starting at 58 to 70 per 1,000 at the age 15 to 19. Back in 2010, USAtoday.com done a report on a school system located in Alexandria, Virginia. The school moved an adolescent health center into the school next to the guidance office. Originally, the schools were 3 blocks away. The center was 3 blocks away. This clinic is staffed by a full-time primary care physician and nurse practitioners. Since the move, the student use of the clinic has doubled. The social worker, Mr. David Wynn, stated that the most striking to him and other teachers was that they have not seen as many girls making their way to class 7 and 8 months pregnant. Before the move, the clinic reported there was 50 pregnancies, but 1 year of being in the school, the number dropped to 35, and the average of 10 to 20 within 2/3 of that year. This was due to having convenience to the clinic. Taking a sex education class could prevent teens from having sex. However, if they are interested, they will take a safer approach. At AdvocateYouth.org, it tells us that sex education classes rely on teaching methods implemented by trained educators that will assist youth to develop skill in communication, refusal, and negotiation. Provide medical accurate information about both abstinence and contraception. Have clear goals for preventing HIV, other STDs, and teen pregnancies. It also addresses psychosocial risks that protect factors with activities to change each target risk and to promote each protected factor. 89% of parents believe that it is important for teens to have information about contraception and prevention of STDs and the sex And the sex education class should focus on how to avoid unattended pregnancies and risk of getting STDs. Shown on Gallup.com, 38% of teens who had taken sex educational class said the class was very helpful. 60% of teens get their information from television, 52% from their friends, and 47% from magazines. With this being said, a sex education class could give teens the correct information and the not so curious and engaging into the activity. In conclusion, I believe teens should take a sex education class to receive the proper information. So many of our teens are misled on the real facts about sex. As I stated in the opening of my speech, at this age, you're supposed to be changing the world, not changing diapers.